Another day, another story. What causes migraines? Causes, treatment, types, and symptoms. Migraines are a type of intense headache that can cause debilitating pain, nausea, light sensitivity, and other symptoms. Despite the prevalence of this condition, the exact cause of migraines is still unknown. However, there are several potential factors that have been identified as possible triggers for migraine attacks. In this article, we will explore some of the possible causes of migraines and discuss ways to reduce the risk of experiencing a migraine. Types of migraines. Migraines are a type of severe headache that can cause intense throbbing or pulsing in one area of the head and is often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. There are many types of migraines, including classic migraines, migraine with aura, abdominal migraines, and chronic migraines. The cause of migraines is not fully understood, but it is thought to be a combination of environmental and genetic factors. Triggers for migraines can include stress, lack of sleep, bright lights, certain foods, and hormonal changes. Cause of migraines. Migraines are a common disorder that can cause severe, debilitating head pain. While the exact cause of migraines is unknown, there are several triggers that can bring them on. These triggers can include certain foods, stress, changes in sleep patterns, hormones, and environmental factors such as exposure to bright lights or certain odors. Other potential causes of migraines can include genetic factors and certain medications. It is important to note that not all people with migraines have the same triggers and that what causes one person's migraines may not cause someone else's. Knowing the triggers that can bring on a migraine can help individuals reduce the frequency or severity of their migraines. Environmental factors. Migraines are a common and often debilitating neurological disorder that affects millions of people each year. While the exact cause of migraines is still unknown, it is widely believed that they are the result of a combination of triggers. Environmental factors, such as changes in weather, humidity, barometric pressure, and stress, are known to play a role in the onset of migraines. Some studies suggest that certain foods, such as aged cheeses, processed foods, and certain food additives, may also trigger migraines. Additionally, environmental factors such as bright lights, loud noises, and strong smells can also cause migraines. Identifying and avoiding environmental triggers can help reduce the frequency and intensity of migraines. Stress. Stress is one of the most common causes of migraines. Stress can be caused by many different things, such as a demanding job, financial worries, relationship issues, or even just everyday life. While there is no surefire way to prevent migraines caused by stress, there are some steps you can take to reduce your risk. Regular exercise, meditation, and relaxation techniques can help reduce stress and decrease the frequency of migraines. Eating a healthy diet and getting enough sleep are also important in reducing stress and preventing migraines. If stress is causing frequent migraines, it may be time to seek help from a medical professional. Poor sleep. Poor sleep is a common cause of migraines. People who suffer from poor sleep, such as those with insomnia, are at an increased risk for migraine headaches. Poor sleep can be caused by a number of factors, including stress, depression, medications, caffeine, alcohol, and sleep disorders. Disruption of the normal sleep cycle can also be a factor in migraine headaches, as it can cause the body to release hormones that can trigger a migraine. Additionally, people with poor sleep are more likely to have other migraine triggers such as bright lights, strong smells, and loud noises. Poor sleep can lead to fatigue, which can also increase the risk of migraine headaches. Therefore, it is important to get enough quality sleep on a regular basis in order to reduce the risk of migraines. Poor diet. Poor diet is one of the most common causes of migraines. Eating unhealthy foods such as processed meats, fried foods, refined sugars, and other unhealthy additives can lead to a migraine. Studies have also shown a link between certain food additives, such as artificial sweeteners, and an increased risk of migraine. Additionally, not eating enough or skipping meals can also trigger a migraine. Drinking too much alcohol, especially red wine, has also been associated with an increased risk of migraine. Eating a balanced diet with plenty of fruits, vegetables, and whole grains can help reduce the risk of migraine. Additionally, avoiding triggers like certain foods or additives can also help reduce the frequency and intensity of migraines. Weather changes. Migraines are a type of headache that can be triggered by a variety of things, including weather changes. For people who suffer from migraines, changes in humidity, temperature, barometric pressure, and wind can all act as triggers. While scientists don't fully understand why weather changes trigger migraines, it is thought that they can cause changes in brain chemistry and affect the release of neurotransmitters, resulting in the onset of a migraine. Other environmental factors such as air pollution, pollen, and dust mites can also contribute to the onset of a migraine. Additionally, people who are sensitive to certain smells or foods may find that the smell or taste of these items are amplified when the weather changes. To reduce your risk of triggering a migraine due to weather changes, it is important to pay attention to your environment and take steps to minimize your exposure to potential triggers. Loud noises. Loud noises are a common cause of migraines. Sharp, loud, and sudden noises can trigger migraine headaches, as well as prolonged exposure to loud sounds. Due to this, it's important to protect your ears from loud noises. Wearing earplugs or noise-cancelling headphones can help reduce your exposure to loud noises and reduce your risk of migraine headaches. Additionally, avoiding loud places such as concerts, bars, and clubs, or taking breaks from loud activities such as mowing the lawn or using power tools, can help to reduce your risk of migraines. Exposure to light. Exposure to light is a major trigger for migraine headaches. Studies have shown that even small amounts of light can cause migraines in people who are sensitive to it. This is because light interferes with the production of melatonin, a hormone that helps regulate sleep. When melatonin levels are disrupted, it can lead to headaches, fatigue, and other symptoms. In addition, certain types of light, such as fluorescent and LED lighting, can be more likely to trigger migraines than other types of light. To reduce the chances of a migraine, people who are sensitive to light should avoid bright or flashing lights, and limit their exposure to artificial lighting. Wearing sunglasses or a hat with a brim can help to protect the eyes from bright light. Hormonal changes. Hormonal changes are one of the most common causes of migraines. Hormones play an important role in regulating the body's functions. Changes in hormone levels can have a significant impact on the body, including the development of migraines. The most common hormonal triggers are related to the menstrual cycle, pregnancy, and menopause. Women are more likely to experience migraines due to hormonal changes, but they can affect both men and women. During the menstrual cycle, hormones such as estrogen and progesterone can trigger migraine headaches. During pregnancy, hormone levels can change significantly, which can lead to migraines. Menopause can also cause hormonal fluctuations, which can induce migraines. Other hormonal changes can also be a trigger, such as fluctuations in stress hormones like cortisol. Identifying and managing hormonal triggers can help reduce the frequency and severity of migraine headaches. In conclusion, there is no one single cause of migraines. Many factors can contribute to the onset of a migraine, including genetics, lifestyle, environmental factors, hormones, and medications. It is important to work with a healthcare provider to determine the underlying cause of your migraines and develop a treatment plan.